All right, good afternoon. The Joint Budget Committee will resume.
I'm taking my coat off. I'm getting ready. Here we go.
All right, Director Birch. So the next topic on our agenda is home and community-based services and consumer direction. Do you want to go ahead and give us a brief? Members, let's get ready. Let's go.
Thank you,
Director
Madam.
Birch, will you please go ahead and give us the highlights from some of these questions?
Great. So, Madam Chairman, I am going to ask Suzanne Brennan to give you a brief overview because long-term services and supports is so critically important to our future initiatives, and I wanted to take you into a little bit more detail about what we have in store.
Okay, great. Ms. Brennan.
Thank you, Madam Chair. I do have some opening comments, but I also know the committee is very well versed in community-based services and long-term services and support, so I won't belabor it and make sure we have plenty of time for questions. Just a couple of key points. LTSS is absolutely critical initiative for the department to redesign how services are delivered to clients. I want to remind the committee that we're talking about $1.2 billion worth of services. This is a very large area of the department, a lot of different programs, a lot of things we are trying to enhance and change over time, and we want to be very thoughtful and planful in how we go about making changes to programs. So I think that's very important, overarching point to understand. $1.2 billion we are seeking to fundamentally restructure with significant input from the community. We want to make sure we're doing it in a very thoughtful and planful manner. So that's kind of just a framing comment. I know the committee had a lot of questions about CDAS, and so I just would like to make a few clarifying comments about CDAS. Currently, we have the CDAS program in 3 of our HCBS waivers: the elderly blind disabled waiver, the community mental health supports, and the spinal cord injury waiver. EBD is our largest waiver, so a very large number and percentage of our long-term care clients have access to CDAS. We're adding CDAS to the brain injury waiver in January. Actually, it's been approved by CMS, which is very great accomplishment for our staff and our clients. Another key thing is we are taking the persons living with AIDS waiver and we're rolling that into the EBD waiver. So those clients will also have access to CDAS. There are only 2 adult waivers that currently do not have CDAS. One is the SLS waiver, and the other is the DD waiver. We are working to enable CDAS in the SLS waiver. Now, I want to make an important point about CDAS. CDAS covers 3 very specific services. The first is personal care, the second is homemaker, and the third is health maintenance. The DD waiver does not include these services. So CDAS covers services that are not in the DD waiver currently. And so we'd have to work through that if we're going to put CDAS into that DD waiver. There's also another stream of conversation that's happening with the community, and that stream is a conversation about self-direction, which is broader than CDAS. And so we have to reconcile those 2 desires and efforts. We also have some children's waivers that don't cover the services in CDAS, and that is also something we would have to reconcile in putting CDAS into the waivers. At the same time, we're looking at waiver simplification, and then we're also looking at community first choice as an option for the state. And really, CFC is the ultimate solution for consumer direction and consumer choice at a broader level. And so it's really important as we're thinking through these changes, how do we sequence the different efforts? When is the right time to make these changes? And in our answers to questions, what we talked about, in particular around community first choice, it is very complicated operational, programmatic, and fiscal things that have to be accounted for. Colorado is one of the early front runners in looking at community first choice. There's only 3 other states in the country that I know of right now. There could be a couple others that have received CMS approval for community first choice. So we are definitely pushing the envelope on driving this program. We support it as a department, and we're committed to continuing to look at how do we operationalize it. That being said, I know there was a question about when we thought it would be wise to implement it. We do not think it would be wise to implement it by 2015. We're thinking 2016 at the earliest. And actually, I was just reviewing some notes from the CFC Council meeting that occurred on Monday, and based on what I saw there, it looks like some of our stakeholders believe we might not even be wise to implement it by 2016. But we'll be working with the community to find out what is the right date to do that. So with that, I'll just open up for questions.
Mr. Vice Chair.
Thank you. Let's start with community first choice. I'm looking at your response to number 22, and you start off by saying the department supports many of the goals of community first choice. Which of its goals don't you support?
Madam Chair.
Ms. Brennan.
Sometimes in writing these responses, we don't always edit them exactly as we would like. And so I have to tell you that I saw that and I was like, well, I had the exact same questions. That is not true. We support the goals of CFC.
Okay.
Any further questions? Oh, looks like they're pointing at each other. Senator Aguilar.
Thank you, Madam Chair. And I know that this has been a frustration amongst the community getting CDAS rolled out. Another frustration I've heard is that the CDAS and IHSS, while very similar, still have differences between them. And I wondered what your opinion would be on at least trying to make those programs more similar in terms of what waivers they apply to and what rules they have to adhere to.
Madam Chair, we're definitely looking at that to try to make them more similar so that there's less continuity of services for families if they move between those two options.
Representative May.
Thank you, Madam Chair. Thank you for that. Just one simple question. Who are the 3 states that are interested? Do you know?
Madam Chair.
Ms. Brennan.
California, I think, Oregon. I can get you the answer. I know Maryland is in queue, and I also know that Alaska has been very interested in it as well. So, California, Oregon, Maryland.
Representative May.
Thank you, Madam Chair. I really meant it to be easy. Sorry about that. But here's a real tough question for you.
No.
I think what we struggle with when you have the community come in and you have presentations from the varying groups about, I really need this or I really need that, or whether it's CDOS or Community First, et cetera, there's this drive in the system to change. And I think it would be helpful for me as a committee member is if, not right at this moment, but you would provide us with, how long does it take to do a waiver change? And how long does it take for the system to do a change like CDOS? And how, you understand what I'm saying? Because I think what we're at right now, we're in a crux where we're making a big system change. And what you're saying to us is if we try to do all these other changes, we can't do the big change. And then we're spread so thin that we're not doing anything correctly. And so I think it would be very helpful for me to say, here's the timeline for X, Y, and Z. And a perfect example is what Senator Aguilar was saying. Sorry about that. Was saying was, to get these 2 waivers to be similar, what does that take and how long? And I think that would be very helpful to the committee, because what it feels like, and I know that's not your intention, is that you're dragging your feet on all these things. And I know you're not, but I think the struggle is there's no priority about when you're going to do what and how that should flow and the rationale. And I think that would just be very, very helpful.
Ms. Brennan.
Madam Chair, I greatly appreciate that. We are working on a timeline of what would happen when. One thing that I and we try to look at is if we take an initiative, is it going to be rendered obsolete by another initiative not too far down the path? And so that is what we're trying to work through in terms of what things should happen, what things should we not pursue because they're going to be rendered obsolete by something else like CFC. But at the same time, we also have to balance how long will it take to do CFC and when should we just go ahead with these other efforts. So, for example, one thing we're looking at is services in the community. We're not willing to wait for CFC to enable services in the community, so we are moving ahead with that. That would be one example, but we can get this to you.
Great. Mr. Vice Chair.
Thank you. So regarding IHSS, it's my understanding this is going to be going through we're going to be considering sunset legislation on this year. I think I know who's sponsoring that bill. It's my understanding that let me see, this one doesn't trip off the tongue. PDPPC, heads are nodding, okay. Consumers and providers have recommended expanding that to all the waivers. Is that something that the department will be supporting through the sunset process?
Ms. Brennan.
Madam Chair, I'm sorry, off the top of my head, I can't remember the answer to that question, but we can get it to you. Again, it is also related to which waivers are going to combine with other waivers. But we can get you that information.
Okay. Oh, Mr. Vice Chair, did you have a follow-up?
Go ahead.
Senator Aguilar.
Thank you, Madam Chair. And what is the timeline for a waiver consolidation?
Ms. Brennan.
Madam Chair, it's multi-year, and it extends over the next 2 years, I believe, is approximately the timeline. The first two waivers that we'll combine are the persons living with AIDS and the EBD waiver this spring, and then the second is SLS and DD.
Mr. Vice Chair.
So which will happen first? Will CDAS be expanded to SLS, or will SLS and DD waivers be merged?
Ms. Brennan.
Thank you, Madam Chair. That is one of the questions we have to look at. What I believe is going to happen is that CDAS will move into the SLS waiver because combining the SLS and DD waivers are going to take more time, and so we don't want to delay CDAS being available in that waiver. And also, what we're going to actually do is allow at the SLS waiver and the DD waiver to continue for a period of time, create a third waiver that combines all those services together, and then migrate clients to that third waiver over time.
Mr. Vice Chair.
And will CDAS be an option for the new third waiver?
Ms. Brennan.
Madam Chair, I don't exactly have that answer yet. I think it also does correspond to when CFC comes into play and how CFC relates to CDAS as well.
Okay. Looks as though that takes us to page 17 regarding the Olmsted decision. Who would like to give us just a real brief overview of your responses?
Madam Chair, thank you. So as we wrote in our response, Colorado has been a leader in home and community-based services, and we are very committed to the Olmsted Plan. That plan is scheduled to be completed by February, and it has been a major initiative of the Community Living Advisory Group, and it has involved multiple departments and intense collaboration between HCPF, CDPHE, Department of Housing. And if there are any questions, I'll take those now.
Representative Rowe.
Thank you, Madam Chair. So the second part of, there were two questions on 23, and I asked that question. The second question was, how many people have been transitioned from skilled nursing facilities to the community? Could you show me within your response where you answered that question? It looks like you've given me some, in the last 7 months, how many, and you said you've got 156 people working in with transition coordinators, but I don't see an answer to my question.
Ms. Brennan.
Madam Chair, we did not exactly answer your question, Representative Giroux.
Thank you.
And the answer is that we haven't tracked that data in the past. CCT does enable us the opportunity to track it more carefully, but what I really wanted to make the point in relation to this question is that Colorado has a very low percentage of clients in nursing facilities relative to other states. And so what's important to look at is the number of clients in nursing facilities has remained somewhat stable, even though our population has grown, even though the number of aging clients has grown, while the number of clients in HCBS has grown. And so Colorado, from my perspective, has done a good job at diverting people from nursing facilities and not having the number of clients in nursing facilities grow. Now, that being said, with CCT and this intense focus on transitioning clients out of nursing facilities, we'll be tracking it and we will be able to look at that. But I'm not sure I would expect that the number of clients in nursing facilities would go down over time, given the growth in the population and the growth in the aging. But those are things we're going to be monitoring.
Representative Rowe.
Thank you, Madam Chair. So if you had one of your providers come to you and you asked them a question and they did everything but answer the question, what would you think?
Ms. Brennan.
Madam Chair, I appreciate your comment, and I believe that we misread the question and we tried to answer it. We did discuss how we should answer it, and we misunderstood the question.
Representative Giroux.
Thank you, Madam Chair. Okay, so that's the second question that you haven't answered. When can I expect an answer to my first question? That was how many have transitioned? And I don't mean, I'm not trying to beat you up about this, but we have an ongoing theme here that is really frustrating because we honestly are trying to work with you, but it's just very frustrating. We are not trying to set you up for failure here, but it's very frustrating when we go through these. And quite honestly, you're not the only department that we're hearing this from this year. So just so you know, there are others that we have a little bit of frustration with. But particularly, and I know that we are term limited, and I know that the faces change here, but that doesn't mean that the integrity of the office or the sincerity of the question should be ignored.
Yeah. Who would like to respond? Ms. Brennan?
Madam Chair, we will take that question back. I will confer with staff in terms of our ability to answer you. We do have a number of data analytics staff who can help us attempt to answer this question. I want to check with them before I commit to what we can and cannot do.
Representative Giroux.
Thank you, Madam Chair, and thank you very much for that. I appreciate that response. If there is something in the written questions that we submit to you that you can't answer or don't have the information, we actually understand that when you respond to us, but when we ask a question and you don't answer the question, that sends a different message to us, just so you know.
Okay, thank you.
Mr. Vice Chair.
Thank you. I want to, just before we leave this topic, try to understand what can the General Assembly do and this committee do to support your work in getting to some of these goals that I think we all share, but they feel like they're still pretty far out there on the horizon. 2016 seems like a long time from now. Last year we appropriated additional FTE for you to have more help with stakeholder relations. I think we had a couple other new FTE positions in there as well to try to, understanding that, your department is relatively small in terms of staff and huge in terms of your budget. What can we do to prod this along? Are there things, and when I say this, it's community first. It's the waiver simplification and mergers. Are there things that the General Assembly can do to make this any easier for you, or is it really, a 3-year bureaucratic quagmire?
Madam Chair, Senator Stedman, I think the continued participation in the Office of Community Living process is really critical. I also think the department will be needing some assistance in the future about greater research and evaluation needs. So again, some additional FTE requests. But we believe in some of the savings that are likely to be generated. We're very mindful of not creating more strain on the general fund budget. So we believe through some of the savings that we can actually come to you and show how savings can fund some of our additional needs. So at this point, I think the ongoing participation is really important. Certainly working with us as we move forward with payment reform. If there's a way we can get into a more nimble, quick process. I know the stakeholder options that we presented today weren't quite palatable, but we would be thrilled to take the 1.5% plus an additional 0.5%. Funding helps because then we can move forward with kind of moving into the new reality of payment schemes. So I think working with us as we go through, obviously you can hear from some of our responses today, there's a number of variables that are changing very quickly as we go through healthcare reform, opportunities that continue to present daily, if not, weekly, if not daily on federal resources, because we are very mindful of not creating more strain on the state budget, but also moving into kind of a new long-term services system.
Mr. Vice Chair.
Thank you, and I appreciate that answer. And I'm sincere in wanting to know, are there things in statute, are there resource issues that would help smooth this along or speed this along? Or is it really, that dicey, the rapid pace of change, that you have to be this careful. And that's just me talking, and I don't want an answer to that. I have a really quick question, and that's just because I was in this section. At one point, you talk about our match rate of 50%, and we just learned, because I didn't know about the new FMAP, and we haven't been briefed on the supplemental and budget amendments yet, obviously. What is the new rate? When did that take effect? When did we find out?
Director Birch or Mr. Bartholomew?
Thank you, Madam Chair. Senator Stedman. The match rate will take effect in October 2014. It will be 51.01%.
Madam Chair, Senator Stedman, we learned of that change last week when all the other states in the United States were notified as well.